perhaps even later. Joining me live right now, Democratic House Majority Leader, Congressman Steny of Maryland. And a good morning to you, sir.
Good morning, Alex. Good to be with you.
I'm glad you're here. It's a big day, and I know that both you and Speaker Pelosi have been saying for weeks now that you are very close to getting the 218 votes needed to pass this bill right now. This morning, how many votes do you have in your back pocket?
We think we're going to have 218 by the time we vote on this bill later on this afternoon or early this evening. We think all the members of the Democratic Caucus, without exception, believe that we need to pass major health care reform so that we can make health care affordable and accessible for all Americans. This bill accomplishes that, and there's some disagreement on some issues, but there's universal commitment to passing a health care reform bill, so we're confident we're going to have the votes later today.
Okay, until that time, sir, there are a couple of issues that will be discussed within members of your own party. The serious concern about this bill that some worry that voting for it might seem like they approve of the use of federal funds for abortions. There's also some controversy over whether illegal immigrants will be covered. Have you reached a compromise on those issues, or is that what still lies ahead today?
No, we believe the bill presently provides that no funding will be used for abortion, no federal funding will be used for abortion. There was an amendment out of the Energy and Commerce Committee that's incorporated in the bill that accomplishes that objective. And in addition to that, there is going to be an amendment offered, in my view, which was made and ordered by the Rules Committee, which will make it very, very clear that no funds will be used for abortion. In addition to that, the President's made it very clear, the bill makes it clear, there will be no funding for illegal immigrants or undocumented immigrants into this country in this program. So and we've made that clear.
You've made that clear, but those members of your party within the Hispanic Caucus, what are they saying to that?
Well, I expect the members of the Hispanic Caucus to support this legislation as is written. I expect them to be supporting the rule, and we'll see what kind of other amendments are going to be offered. If there are other amendments offered on this issue, we'll have to see what they are and see whether they're consistent with a healthy America.
The President's set to make a visit there to Capitol Hill today, a little more than 3 hours from now, to speak to the Democratic Caucus. What's the purpose of his visit, and what do you expect him to say?
The President, along with every other presidential candidate last year, Republican and Democrat, indicated that health care reform needed to be a very, very important part of America's agenda. 47, 48, 49 million Americans uninsured, outside of the health care system, subsidized by those who are paying premiums, not participating in providing some contribution to their own insurance, was unacceptable and unsustainable. So the President's coming here as a candidate who said he was going to do something, now as President who is in fact leading the effort to redeem that promise to the American people for which they voted, to have health care that's affordable for middle income and all Americans. In fact, we just had 2 elections to the Congress of the United States within the last 76 hours, and in both of those races, health care reform was an issue. In both of those races, the Democrats won. In one of those districts, a Democrat hadn't won for 100 years, and health care was the issue. Both of those new representatives, having just come from the electorate, one on the West Coast, one on the East Coast, are going to be voting for health care reform.
All right, let's talk about those members, though, on the other side of the aisle, sir, because the GOP leaders say all 177 House Republicans, they all stand ready to oppose this bill and claim that the public option is a plan for the government to take over the insurance industry. How concerned are you, Representative Hoyer, about the possibility of not getting any bipartisan support for this bill in the House?
Well, I very much regret, and the President regrets, and all of us regret, that we haven't had bipartisan engagement in this bill, and that we're not going to have, apparently, bipartisan support. But we're not surprised. The Republicans have been the party of no for this entire year. They have unanimously voted against almost every effort to move the economy forward, to reinvest in the recovery from the deepest recession we've seen in 75 years as a result of the economic policies that were pursued by the previous administration. The Obama administration inherited the very, very distressed economy. We're trying to bring that back, and unfortunately the Republican Party has continued to be the party of no. We hope that that's not the case today, but I will not be surprised if it is.
But Representative Hoyer, when all is said and done and you're able to look back on this, will you be confident that Democratic leaders reached out enough across the aisle to bring Republicans on board?
Absolutely, I will be confident of that. I have a very good friend who's the former Republican whip, Roy Blunt, who headed up the task force. He and I met 2 or 3 times in my office with my offer to saying to him, let us see the alternatives that you have. Let us sit down together and discuss where we might go. And unfortunately, he was unable to do that, not so much because, in my opinion, he didn't want to do it, but his party didn't want to do it. Charlie Rangel, who's the chairman of the Ways and Means Committee, reached across to the minority member, and he was effectively told, no, we don't want to engage. So I think there's been a considered political conclusion by the Republicans that what they want to see is failure. As a matter of fact, one of the United States senators said that health care could be Barack Obama's Waterloo, implying that the Barack administration would lose on health care. In fact, if we lose on health care, it will be the American public that will lose. It will be people who don't have access to affordable quality health care who will lose. It will be a nation that will not be as healthy as it should be that will lose. So I am still hopeful at this 11th hour that there will be Republicans who will join with us in moving this legislation forward to conference committee so that we can hopefully together come up with legislation, as almost every candidate, including Senator McCain, suggested we need to do, to have a comprehensive health care reform program that will provide that quality health care for all Americans that is needed.
Democratic House Majority Leader, Congressman Steny Hoyer of Maryland. It's going to be a long day for you. What time, sir, do you expect this vote to go down tonight?
Well, we'll see how the date goes. You know, it's sometimes difficult to project, but I would think it'll be sometime early evening.
Okay. As you know, MSNBC are watching. Thank you so much.
Thank you very much.
And for all of you, I want to let you know we will have representatives from the other side of the aisle. We'll be talking with GOP Congressman later on and a Congresswoman, Marsha Blackburn, a bit later on this morning here on MSNBC Saturday. Meantime,